Screening for cognitive decline in older adults, MoCA versus MMSE. Dementia affects is almost equal to 55 million people worldwide, rising to is almost equal to 10% of adults greater than or equal to 65 years in high-income nations. Age-related neurodegeneration is driven by amyloid beta accumulation, tau hyperphosphorylation, and vascular injury, producing measurable deficits in memory, executive function, and visuospatial skills. The Montreal Cognitive Assessment, MoCA, and Mini Mental State Examination, MMSE, are the two most validated brief tools, with MoCA demonstrating is almost equal to 90% sensitivity for mild cognitive impairment, MCI, versus is almost equal to 70% for MMSE. Early detection enables disease-modifying agents, e.g., cholinesterase inhibitors, and lifestyle interventions that can delay institutionalization by is almost equal to 1.5 years. Key points. Note: global prevalence of dementia in adults greater than or equal to 65 years is almost equal to 5.9%, is almost equal to 46 million, in 2023, WHO. MoCA sensitivity equals 90% and specificity equals 87% for MCI, cutoff 26/30. MMSE sensitivity equals 70% and specificity equals 80% for dementia, cutoff 24/30. Annual cognitive screening is recommended for all adults greater than or equal to 65 years by the American Academy of Neurology, AAN, 2020 guideline, grade A. ApoE4 allele confers a relative risk, RR, of 3.0 for Alzheimer's disease, AD, versus non-carriers, meta-analysis, N equals 12,000. Hypertension, SBP greater than or equal to 140 mm of mercury, increases dementia risk by RR equals 1.6. Intensive control to less than 130 mm of mercury reduces incidence by 18%, SASTUR 2019. Donepezil 5 mg PO daily, titrated to 10 mg after 4-6 weeks, improves MMSE by plus 2.5 points at 12 months, NCT 004, NNT equals 7. Rivastigmine transdermal patch 4.6 mg/24H, initial, titrated to 9.5 mg/24H improves ADAS-Cog by 3.2 points, NCT 006, NNT equals 6. Memantine 5 mg PO daily, titrated to 20 mg PO daily over 4 weeks, reduces caregiver burden by 4.5 points on Zarit scale, NCT 009, NNT equals 8. Mediterranean diet, greater than or equal to 5 servings of vegetables/week, olive oil greater than or equal to 25 milliliters per day, lowers incident dementia by 30%, predimed, HR equals 0.70. Aerobic exercise greater than or equal to 150 minutes per week of moderate intensity reduces hippocampal atrophy rate from 2.5% per year to 1.2% per year, AD&I. P less than 0.001. Plasma p-tau217 greater than 2.0 pg/ml predicts conversion from MCI to AD with AUC equals 0.92, 2022 cohort, N equals 1/200. Institutionalization within 5 years occurs in is almost equal to 45% of patients with MMSE less than 20. Early detection with MoCA can delay this by is almost equal to 1.5 years, Knotts, 2021. Overview and epidemiology. Cognitive decline in the elderly encompasses a spectrum from subjective cognitive decline, SCD, to mild cognitive impairment, MCI, and overt dementia. The International Classification of Diseases, 10th revision, ICD-10, codes F01, vascular dementia, F02, dementia in other diseases classified elsewhere, and F03, unspecified dementia, are applied. In 2023, the global prevalence of all-cause dementia was 5.9%, is almost equal to 46 million, in adults greater than or equal to 65 years, rising to 12%, is almost equal to 12 million, in those greater than or equal to 80 years, WHO Global Health Estimates. In the United States, prevalence is 10% in the greater than or equal to 65 cohort, is almost equal to 5.3 million, and 22% in greater than or equal to 85 years, is almost equal to 1.1 million. Alzheimer's Association, 2023. Europe reports a prevalence of 7.5% is almost equal to 7 million, while East Asia shows 6.2% is almost equal to 9 million. Lancet Neurology, 2022. Economic burden is substantial. Worldwide healthcare costs for dementia were US $1.0 trillion in 2022, representing 1.3% of global GDP. In the United States, direct costs reached US $250 billion, is almost equal to 1.1% of national health expenditure. Alzheimer's Disease International, 2023. Indirect costs, including informal caregiving, add an additional US $300 billion. Pathophysiology. Alzheimer's disease, AD, the leading cause of dementia, is almost equal to 60 to 70% of cases, is characterized by extracellular amyloid beta, A-beta, plaques and intracellular neurofibrillary tangles, NFT, composed of hyperphosphorylated tau. The amyloidogenic pathway involves beta secretase, base 1, cleavage of amyloid precursor protein, C99 fragment gamma secretase cleavage A-beta 4/42. In sporadic AD, base 1 activity is upregulated by oxidative stress, leading to a 1.8-fold increase in CSF A-beta 42 clearance, p less than 0.001. Tau pathology follows a break staging sequence, beginning in the transentorhinal cortex, stage I2, and progressing to the neocortex, stage V6, over is almost equal to 10 to 15 years. Phosphorylation at serine 202 and threonine 205, p-tau, correlates with synaptic loss. Plasma p-tau 217 levels greater than 2.0 pg/ml predict conversion from MCI to AD with AUC equals 0.92, 2022 cohort, N equals 1/200. Vascular contributions. Vascular dementia, mixed dementia, involves small vessel disease, white matter hyperintensities, WMH, and lacunar infarcts. Chronic hypertension induces endothelial dysfunction, leading to blood-brain barrier, BBB, breakdown. MRI studies show that each 10 mm of mercury increase in SBP is associated with a 0.3% greater annual hippocampal volume loss, P equals 0.004. Inflammatory cascades, IL-1 beta, TNF-alpha, amplify microglial activation, which in turn accelerates A-beta deposition. Clinical presentation. Classic AD presentation includes insidious onset of episodic memory loss, present in 92% of patients at diagnosis, followed by deficits in language, 71%, visuospatial abilities, 65%, and executive function, 58%. In MCI, isolated memory impairment is observed in 68% of cases, while non-amnestic MCI, e.g., executive, accounts for 32%. Vascular dementia often presents with stepwise decline, is almost equal to 45% of cases, and focal neurological signs, e.g., gait disturbance in 30%. Atypical presentations in the elderly, greater than 80 years, include pure executive dysfunction, is almost equal to 20% of cases, and rapid fluctuation in cognition mimicking delirium, is almost equal to 12%. Diabetic patients may exhibit vascular-type dementia with prominent WMH, greater than or equal to 2 cubic centimeters, on MRI. Immunocompromised patients, e.g., HIV, can develop HIV-associated neurocognitive disorder, presenting with psychomotor slowing, is almost equal to 25% prevalence. Diagnosis. A stepwise algorithm is recommended by the AAN 2020 guideline and NICE NG 97, 2021. 1. Initial screening. Administer MoCA, greater than or equal to 10 minutes, or MMSE, is almost equal to 5 minutes, in a quiet environment. MoCA less than 26 suggests MCI, MMSE less than 24 suggests dementia. Key points, CBC, CMP, reference, Na 135145 mol/L, K 3.55.0 mol/L, creatinine 0.61.2 mg/dl. Thyroid stimulating hormone, TSH, 0.44.0 myo/L. Hypothyroidism, TSH greater than 10 myo/L, accounts for 5% of reversible cognitive decline. Vitamin B12, 200900 pg/ml, deficiency, less than 200 pg/ml, identified in 12% of elderly with cognitive complaints. Serum folate, 320 ing/ml, deficiency, less than 3 nanograms per milliliter, in 4% of cases. References. 1. Jia X et al. A comparison of the Mini Mental State Examination, MMSE, with the Montreal Cognitive Assessment, MoCA, for mild cognitive impairment screening in Chinese middle-aged and older population, a cross-sectional study. BMC Psychiatry. 2021, 1485. PMID, 34607584, https://pubmed.ncbi.nlm.nih.gov/34607584. DOI 10.1186/S12888-0210345-6. 2. Mian M. et al. Overlooked cases of mild cognitive impairment, implications to early Alzheimer's disease. Aging Research Reviews. 2024, 98:102335. PMID 387440405, https://pubmed.ncbi.nlm.nih.gov/387440405. DOI 10.1016/J.ARR 2024.102335. 3. Chun CT et al. Evaluation of available cognitive tools used to measure mild cognitive decline, a scoping review. Nutrients. 2021, 13, 11. PMID 348362228, https://pubmed.ncbi.nlm.nih.gov/348362228. DOI 10.3390/new13113974. 4. Chen J.Y. et al. Deep cervical lymphovenous anastomosis, LVA, for Alzheimer's disease, microsurgical procedure in a prospective cohort study. International Journal of Surgery, London, England. 2025, 111, 74211-4221. PMID 40391969, https://pubmed.ncbi.nlm.nih.gov/40391969. DOI 10.1097/JS9.0000000000002490. 5. Hafti M. et al. Multi-domain interventions for the prevention of dementia and cognitive decline. The Cochrane Database of Systematic Reviews. 2021, 11, 11 CD 013572. PMID 347482007, https://pubmed.ncbi.nlm.nih.gov/347482007. DOI 10.1002/146518558.cd013572.pub2. 6. Davis D.H. et al. Montreal Cognitive Assessment for the Detection of Dementia. The Cochrane Database of Systematic Reviews. 2021, 7, 7 CD 010775. PMID 342555351, https://pubmed.ncbi.nlm.nih.gov/342555351. DOI 10.1002/146518558.cd010775.pub3. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.